Dear viewers, peace and God's blessings be with you, and welcome and happy Eid for you in the first day of Al-Adha feast. In this important day, the greatest pilgrimage day, the day of throwing the first stage of pebbles, we look at these beautiful scenes for the first stage of throwing pebbles, while pilgrims are throwing these pebbles very easily, and we ask God that they would complete their pilgrimage and to be an accepted one. And welcome to this episode. I'm honored to have Professor Sayyid Arabi, the professor of chest diseases at the medical school in Ain Shams University, and he is a training for some critical cases. Welcome, Doctor. Happy Eid. How did you see the situation in Arafah yesterday? Yes, it was excellent. Doctor, we'd like to get to know more about things related to pilgrims in general and other people who are watching our program, to get these important information that are useful in these days, or those who will come later on to perform pilgrimage. Yesterday we were talking about the sun strikes. Particularly, we talked before Arafah. Now Arafah has passed. We want to know more about cases of sun strikes, where we have a definition of what a sun strike is and the different temperature of the body. So, in the name of Allah, the sun strikes, or when the body has high temperature because of pilgrims may be subject to the hot and humid atmosphere and exerting efforts. It happens a lot, particularly during Arafah and during Sa'i and circumambulation. So in order to understand this, we need to know how the body can get rid of temperature. It's through different ways, like touching another body which is colder, so temperature is moved from the hot body to the cold one, or through radiation, or the most important thing that our body used to get rid of the excess temperature through sweating and evaporation. So it is a very important means to reduce our temperature. But if we had humidity over 70%, this function is not very well, particularly with old people who are suffering some heart problems or nerve problems or other medical problems. If they are unable to move quickly to avoid the sun. So we advise the old people to be accompanied by their relatives or friends, so that they can help them to get rid of high temperature and to move from hot places to cooler places during all these functions. The problem of this excess temperature, once the body has high temperature, the pilgrim would feel fatigued and tired. Is it like this, very similar to the fever? Sometimes the temperature may reach 40 Celsius, even it cannot be more than 40. So there are certain arrangements at hospitals to detect this high temperature. High temperatures can lead to health problems for pilgrims, feeling tired and fatigue, as we said, and weakness in the muscles, unable to continue with the rituals. In this case, if it happens to any pilgrim, they need to move to a shelter or to a shade place and trying to reduce their body temperature. among the other health problems that can be as a result of being under the sun or under high temperature or unable to reduce this. They have some problems in breathing, and this is also as a result of other things, problems with the lung or some different problems. High temperature of the body may affect the heart. We know the heart is having a certain rhythm and pulses. It's like a clock. In case of high temperature, there may be an imbalance in the rhythm of the heart, and this may let the heart unable to pump blood into the different parts of the body, and this may lead to the feeling of dizziness and ability to concentrate. And also this may reduce to further heart problems that may lead to difficult breathing. There are also problems that may be associated with the brain. Sometimes people are unable to concentrate or having dialogue with people around them. And this is a very important symptom. Once you notice this with any pilgrims, how can you detect these problems? So people around you can feel that you like doing some hallucination, hearing some noises and unable to communicate with people. You will be seeing things that are not there and hearing some voices. In case of deteriorations, things may be complicated until they go unconscious. I would like to ask about very important issue for is high temperature in the sun strikes, does it happen rapidly or gradually? Sometimes a person may be normal and sound, and within few hours he would be unconscious because of a sun strike. Yes, this is true. It happens within few hours. Our human body has like certain metabolism inside the body that causes temperature. Movement causes temperature also. So imagine these two things together. When the body is unable to get rid of this temperature, as we said, the mechanisms that the body uses depend on the temperature of the air around the body that should be less than the temperature of the body. If it is, for example, 40, temperature will not move from the body outside. And in case of humidity, the mechanisms will not be working. Let's have a short break and then we'll be continue with this. So a break.
Our dear viewers, welcome back. Pilgrims safe and sound. And you can contact us through the social media for Iqra Satellite channel and also the website for us. In addition, you can contact us through the phone numbers that will be displayed on the screen. You are also enjoying now this live broadcast from the People's Bridges after the pilgrims have come from Muzdalifah. It was the sunrise of Muzdalifah and they came. They are there. This is what you can see through the Iqra Satellite channel. You will receive also medical instructions by Dr. Saeed Arabi. Doctor, you saw now we have the videotaping of Muzdalifah and Mina from above, and you see the movement of pilgrims in Muzdalifah, the one night stay city where it is filled in within a few hours and it's emptied from people within a few hours. Those scenes that you can see are really amazing and splendid. About the religion, rituals. They are in line with the rituals and the provisions of God. We were talking about the sun strike, and we talked about several issues, including the ventilation and the air when it is less in temperature than that of the body. No, we talked about the opposite. If the atmosphere is higher than the temperature of the body's ability to get rid of the temperature is less, because you know that. So what's your opinion about pilgrimage? A few years ago, there was no air, no shelter, but now we have fans on the Pebble Bridge, and Mina is in a valley. For that reason, now the temperature is between the mountains. At the moment, there is the bridge that you can see on the screen. There are fans and there are shelters with several floors, 5 floors that were built in the expansion project. So the exposure to the sun strike is less. You saw that in the past, and you can compare that if you like. You know the difference for medical concerns. In fact, this is one of the greatest projects done for the pilgrims, which is the Pebble Bridge. It solved lots of problems. First of all, it solved the problem of crowding, different floors, different squares, and the scene has become very spacious, accommodating as many people as possible to throw the pebbles in an easy way. What is more important is that there is shelter, and shelter in that place would reduce the exposure to the sun strike. In addition, those in charge of the project were wise enough to put the fans in order to create streams of air, because it reduces the temperature on the body, which is very important in order to reduce the exposure to sun strike. We no longer hear about sun strikes in the pebbles. We were talking about the sun strike, and we need to know the complications of sunstrokes and what is the medication that can be given in order to reduce the impact on the patients. When a sunstroke happens, as we said, it has to do with the high temperature of the body, more than the ability of the body. It hampers the function of some biological and chemical natural processes inside the body. With the dysfunction of such processes, we have complications. It could be, for instance, hallucination, cramps, it could be falling unconsciousness, and also could be even colds in the lungs because of the fluids inside the lungs. There could be certain problems with the heart, particularly for those people who already suffer from problems in the pulsing of the hearts, for instance, for those who take coronary arteries medications. They are more exposed to the sunstroke. It is a shock. This is definition. It is a shock that happens because of a sudden increase of temperature in the body that cannot be handled by the body. Other problems may happen in terms of the kidney, particularly for those who have problems in the kidney, because the kidney's function is less because of the temperature, because of the lack of fluids inside the body, and leading to stoppage of the kidney's functions. Also, problems may happen in the liver. Some cases were detected of those people who were exposed to the sunstroke, leading to the death of the cells inside the liver, leading, in fact, to the implant of livers in some cases. Some problems may happen in the vessels of the blood, leading to concentrated unit treatment. You mentioned about remedies or precautions. What are the precautions? Now, before moving to the medications, about the sunstroke, what is the treatment? The main treatment is to reduce the temperature, and this is by moving the person who is exposed to the shock, to the sunstroke, to a shelter or to a place which is cooler. This leads to reducing the temperature of the body. We can also reduce that by reducing the clothes. And once again, I repeat that light clothes are very important, are better than the heavy clothes. What about cooling the... yes, cooling the body with water, with ice is very important. Is it like the sweat? Yes. It is very good and very important. And moving to the shelter and exposure to a stream of to an air draft. This is very important. This is what I liked in the design of the pebble throwing bridge, because it provides for an air draft. Even if there is high temperature in the body of any pilgrim, the cool breeze from the fans will reduce the temperature and will automatically eliminate the chances for exposure to sunstroke. Can you give us a tip, a recommendation about the sunstroke? People gather and look at the patient, and they become reasons for preventing such assistance to the patients. This is a very important note that you have mentioned. If a person has a heat stroke or a sunstroke, we have to provide for him exposure to the cool weather. The gathering of people around him will prevent the cool weather to reach him, and leaving him inside that person, for the person, he usually falls down in a sunny place. He must first of all not gather around him. We must move him to a shelter and try to dip his body with water and to help him, to expose him to air. If we gather around him, we are preventing him from being medicated. We move to something else, about some complications of the sunstroke or the other issues. We're talking about fainting and about somebody who has nothing, no problem, and just he passes out. What about the complications? What about the reasons? We want to know what are the reasons for people to faint and unconsciousness. Unconsciousness or fainting has lots of reasons. But for the pilgrims, one of the most important reasons for fainting or unconsciousness, and by the way, unconsciousness means that a person is unable to communicate with others, or he is calm, doing nothing, moveless, or he is unable to respond to the impetus, whether they are visual or loud or sound or pain or touching. If such communication is eliminated, it means that he is in unconsciousness. Fainting or unconsciousness happens to the pilgrim for several reasons that are known, including the low sugar levels in the blood. If he is eating something which is not because he drinks lots of water and he does not eat good nutritious material with sugars, for that reason the low level of sugar will lead him to faint and pass out. And this is particularly important for people with diabetes, because people with diabetes take medicines that reduce the sugar level. If you don't eat what is enough for them, for the sugar, for the metabolism, and for the energy consumption inside the body, the sugar is reduced, and therefore it leads to fainting because of diabetes, which is the case that we find among pilgrims, particularly the elderly, and particularly if those have diabetes already. There are other reasons, as we said, the sunstroke, and less frequent is infections that can happen, like, for instance, the brain infection or any kind of infection in the body, or if there is any kind of complicated problems in the colds in the nerve system, etc. So they have this illness before. Every person who had a problem and who had, for instance, when he is without liquids, with the sun exposure, the lack of blood to the brain may lead to arteriosclerosis. There are many reasons, but how can we diagnose that? To know the reason why a person who fainted, what is the reason that he fainted? That it's very difficult for an ordinary person to know the reason why the unconsciousness has happened. But generally, as we say, it is recommended to all pilgrims who are coming to make the rituals to bring with him a card listing all the diseases that he is suffering from and the medicines that he's taken. So this card, if it is available, if a pilgrim, for instance, faints and he has a card which shows that he has diabetes and he takes insulin, this would give us the diagnosis immediately. If this pilgrim, for instance, mentions that he has some cardiac problems or disruption of the pulses and faints, we will look at the heart and we'll see the problems of the pulsing. Therefore, we know that there is a problem in leading blood to go to the brain. How can we avoid fainting? My tip number one is to bring with them a card with the diagnosis and medicine that he takes, and he has to take as much as possible the liquids. But my question is that a person may faint without any problem, and the bigger problem is that he cannot tell people, I will faint just within a moment. So this is one of the problems. Somebody would walk, they are talking with each other, and one of them passes out. And there is a confusion on part of the other person on how to deal with him. That's right. My recommendation is that he eats well and gets enough sugar. Some people go on fasting for Arafah, and all the day they are not taking liquid or not good adequate amounts of food. And for that reason, they do not have the required sugar in their blood. Other reasons including the fatigue, severe fatigue, and lack of sleeping. It is recommended for a pilgrim to take a good rest so that he can continue with the rituals. Fatigue. Is it fatigue the reason for fainting? Yes. A pilgrim may stop even the rituals because of fatigue and lack of sleeping. Now we will go on a break and come back with you for fatigue. Stay tuned.
Welcome back again, our dear viewers, to continue with our program Pilgrimage Safe and Sound with Dr. Arabi. Dr. Arabi, we were talking about the faintness. And here I would like to talk about the guidance that would be provide pilgrims in case of faintness. And before answering this question, we have Fatima from Saudi Arabia. Fatima from Saudi Arabia. Peace be with you. Yes. Can I speak to the doctor? Yes, please. I have two questions. First, to know what, could you please repeat the questions? She has a problem with the eye, I think. Your second question? Are some like the blood sacs on the liver harmful? The first question, you need to go to see a specialized doctor in the diseases of the eye, because you cannot diagnose. As for these blood sacs on the liver, it depends on the size of these sacs. If you have something like this, you can send us like the tests that you did, and we will explain this particular case to you. Are these sacs harmful on the liver? These blood sacs on the liver, if these like small or minor, does not harm, but if these are big in size, the Arabic actually interpretation is different from the expressions are different. If this is a big sack, it differs from the minor and the small. If they have less than 1 centimeter in size, they are nothing. Regarding the guidance, let's tell us something about pilgrims who are about to faint. Some doctors say that if you feel imbalance of your body or dizziness, then there is something wrong. Yes, this is true. When you feel dizziness or unable to concentrate, you need to tell those people around you that you are starting to feel dizzy and unable to concentrate. This is very important before you fall down or faint. The problem of falling down, this may cause certain traumas or shocks or certain breaks in the body that have very dangerous sequences. Some people say that we need to sit down in order not to fall. Yes, this is true. If you are in a high place, you need to go down quickly and to draw the attention of people around you and to lay down on the ground on a leveled place and to ask for help from people around you. We were just kidding. Before you faint, ask people around you. What about people who are already fainted and in coma and they cannot help themselves? People with them, particularly people are afraid or confused or in a state of tension and unable to help him. Yes, this is true. The natural reaction by people when somebody is fainting before them or losing the ability to concentrate, people usually come around this person, and this is wrong. Actually, we need to give him a space to breathe and open the windows if they are in a closed place, or to let them see the air, or take them to a shelter, and then to get the medical help as soon as possible. And there are certain paramedics and doctors, nurses who are providing medical help to pilgrims in different places. Then if this person is able to swallow, we can give them any concentrated solution which is sweet. If they have like sugar, we need to provide their body with sugar. This happened in Arafat when some of the Iqra staff has fainted because of the lack of sugar and because of the effort that he exerted a lot. And those are the people who are working all the time without eating or drinking. So after he waked up, he told us that he didn't sleep for 48 hours. We will have a phone call from Raja from Saudi Arabia. Raja, yes, please. Peace be with you. I would like to ask the doctor about vitamin D. My daughter took vitamin D when she was a kid, and then she stopped taking this. Now she's improved after we did the blood analysis. But I feel now she's getting back. Shall I give her the vitamin D? Does it have any harmful to the health? If she has a lack of vitamin D, and now things are better and she is getting back to these symptoms, I think we need to measure this vitamin again. If she has a shortage in this vitamin, a specialized doctor would prescribe her the right dosage. If vitamin D in the body of this girl is good and at normal levels, I think you need to go to get the advice from a specialized doctor. So did you get the answer? Thank you. Excellent. the issue of fainting, what are the the descriptions of fainting for simple people to know? If you ask such questions, does this person who has fainted, their eyes may be open, or some people are fainted but their eyes are still open. Some do close their eyes. I'll have Wiam from Saudi Arabia calling us now. Yes. Peace be with you. Yes, what's your question? I would like to congratulate you for the Eid, and also to congratulate the custodian of the two holy mosques. Thank you, Wiam, and happy Eid. As for the open eye during fainting, or is there a difference? The eye breathes and takes, the iris of the eye takes oxygen and the nutrition from air. So the eye should be open for some time. If the person is fainted for a long time, we close the eyes, but we need to open it every now and then. In Al-Kahf surah, God says, you think they are awake while they are sleeping. If their eyes were not open, they would have lost their sight. They would be blind. This is a very important medical information in the Holy Quran. So those in the cave used to open their eyes so that to allow oxygen to come. These are scientific benefits that has scientific basis. The Holy Quran is full of medical miracles. Let's talk about the heart diseases and the heart crisis that may take place during this time for pilgrims. Currently, it is the period of exerting effort by pilgrims from moving from Arafah to Muzdalifah, and then from Muzdalifah to Mina, for throwing the pebbles, and then the Ifadah circumambulation and the Sa'i. This effort is an additional burden on the pilgrims, and perhaps it's either the heart is unable to adapt with this new level of effort, and we have what we call the falling of the heart, or the heart is unable to get enough blood, because it's a muscle like any other muscles. Sometimes football players, when they exert too much effort, they have some contractions with the muscles because of the lack of blood that are feeding the muscles of the foot, and the lack of the sodium salts. So the muscle of the heart works like this. It is supplied by blood through these arteries and veins. So they do not have other ways. So if in case this artery is narrowed, so when the heart is doing more effort, and pilgrims are not used to this level of effort, now the muscle of the heart starts to complain. And the third thing of problems is the heart pulses. So let's stop here and continue the special part about the heart diseases in detail for the benefit of pilgrims and viewers. Dear viewers, this is the end of our episode, but we will continue this topic and the special part about the problems of breathing in our programs, Pilgrimage Soft and Sound. So we're still with you with Iqra Satellite Channel. Thank you.
وسلم تسليما